Welcome to Brilliant Talks, the series that uncovers the innovations and insights that empower people with hearing loss to live brilliantly. In this episode, we'll be talking about hearing health and the importance of mental well-being. Joining me in the studio today, we have Erin and we have Humayun. You're both working at Signia. Welcome, both of you.
Thank you.
Thank you.
Humayun, what does hearing mean for your well-being?
I think it's very, very important because it affects actually your life, your surroundings, and so on. Meaning, if you don't hear well or you don't address it early enough, what would happen is you'll be detached from your lifestyle, your family, your surroundings, you become isolated and you cannot really contribute or even go into some depression that can happen. I can give you an example. Imagine go one day, put cotton balls in your ears and go to your daily routine. What will you feel? Then you feel like, uh-oh, I don't hear over there, somebody called me, the TV is I don't understand, you're watching the news, and then at the end, what happens is like, you stop doing this. That means you change your lifestyle for the worse.
And Erin, what do you think hearing means for our well-being?
You know, when you are cut off from the world because you're not feeling confident, you're not feeling connected to the people you care about, you're not feeling connected to your environment and feeling safe, if you withdraw from all of that, then you're also losing stimulation in your brain, right? You're not seeing, you're not doing, you're not hearing and interacting. And all of that loss of stimulation of your brain has an impact on your mental health as well.
Mm. What happens to your body physically when you have a hearing loss?
If you don't address it early enough or you let it, go on and you don't get the stimuli that you used to get, some studies suggest that actually it would increase the risk of getting or having dementia or earlier stages of dementia. Because what we know is, in general, is when you're active or doing things, you're learning things or listening to things or watching TV and so on, your brain, or listening to music, your brain is always stimulated. And you should not stop stimulating your brain. And if you have a hearing loss and you don't compensate for it, this is actually what happens is you go outside of your life, of your social environment, which indirectly means you're less active, brain-wise active, or doing things that you used to do.
Mm. So which kind of impact does it have on a family, Erin, would you say?
Well, if you let your hearing loss go and you don't reach out and look for solutions, then you might start settling into a pattern in your family where somebody's pulling back and maybe other people are not on purpose, but starting to leave them out a little bit or starting to avoid pulling that person into situations that they previously enjoyed, but that they seem like they're struggling in now. So it kind of creates a little bit of a cycle that reinforces itself. Somebody starts to pull away, and then maybe they end up keep pulling away.
Do people know that they need to react very quickly?
No, I don't think so. I mean, it's getting better. I believe it's getting better. Usually what happens is if somebody has a hearing impairment, I believe the first thing they do is try to hide it. Until it gets worse, and then people around start to notice it. So you talk less to that person, the other one is not attending maybe some family gatherings anymore, or finding some excuses not to be in the social, events or social activities that they used to do. Mm. So in that way, then you delay seeking even problems, unless what happens, or hopefully what happens, is you have family members or friends that try to push you into that direction. They say, maybe, you should seek, to solve your problem, get hearing aids, try it out, and so on. And this is not actually something that you should be ashamed of.
Would you say that hearing is an overlooked sense?
Well, I do think sometimes that, until people understand that they're having trouble with it, they do kind of take it for granted. Because what happens for people when they lose their hearing is it's not that they lose all of their hearing. They very often feel that I can still hear, I just can't understand, or I'm just not hearing everything. And so they will push it and they will wait to get hearing aids because they think, oh, it's not bad enough yet. I can still hear, just sometimes I have trouble. But then what happens is if they don't get hearing aids, as soon as they're noticing trouble, if they keep pushing and pushing and pushing, then their auditory system is not getting the stimulation that it's used to getting. And the pathways in the auditory system can start to weaken in a way, kind of like a muscle that you're not using. And so when they do finally decide, okay, I'm struggling so much, I'm ready for hearing aids, it can be even harder for them to then get used to wearing the hearing aid again and suddenly getting all that stimulation on a pathway that hasn't been used to it.
When should you get some help? I mean, when do you need to react?
Well, I think from the moment there's any question, or even before, just get your hearing checked. Just know what your hearing looks like. And if it still looks good, great. You've got a good baseline. And then, as soon as you're wondering, am I missing some things? Or your family or your friends are telling you that, it seems like I'm not sure you're always hearing as well as you should. Go get it tested again. Just see what it looks like. Start talking about options. You don't have to make any decisions immediately, but just stay on top of it, get it checked, and then you can react when you need to.
Good point. Let's bring in the conversation our third member, should you say. Thomas, you're with us from Germany. Thank you for joining this conversation that we're having in this studio today. Apart from having a hearing aid, you also work in Signia as well as Human Jung and Erin. How was your life before you got the hearing aid?
It was stressful, like in restaurants, to follow conversations. I came home always having headache and said, oh my goodness, this was a tough evening. It's now completely different. I can just go in safely and follow my discussions. The same as I was avoiding phone calls like hell, because based on my hearing loss, to run a phone call was very well. So I needed always a small corner, quiet corner, to accept the phone call. I was even rejecting phone calls. Now, getting them streamed directly into my ear, it's so easy to follow phone calls and conversations.
And when did you realize, Thomas, about your hearing loss?
Was when one of my colleagues during a dinner mentioned, Thomas, you need hearing aids. You're giving answers to questions no one asked for.
That's interesting. And we just talked about that phase from when you sort of detect that you're having a problem towards seeking a solution. How long would you say it took you in this progress?
I got that feedback maybe 4.5, 5 years back. And roughly, let's say, since 4.5 years, I'm wearing hearing aids. It all starts, and I think Erin also mentioned that, to check your hearing. But I would even stress it more and would say what we need is a hearing care, similar like you have health care. From a certain age onwards, we all go for health screening. You check your eyes, you check your skin, you check whatever. But no one is checking on a regular basis your hearing. There is a lot of, let's say, issues connected to that, and it's overlooked. It has to start much, much earlier, so that hearing care is part of health care. Also in young ages, in schools, no one is being trained that you have to take care of your small hair cells in your ear, that they will never regrow when they are broken. So
would you say that your well-being has actually improved a lot since you've got this help?
Actually, that's the fact. When I don't have my hearing aids, and sometimes I test hearing aids, so they are not fully ready, something is not working. So if I then don't have my regular hearing aids with me, I suffer because something is missing. It sounds odd. Music sounds odd. People sound odd because they don't sound like I'm used to perceive them. So it's really, and that is the opposite. When you're fully used to it, you need them. But when you're not used to them, you are not aware what you are missing.
You used to work, I know, in the R&D department. So what's it like developing a tech that you use yourself?
it's very exciting because you have to cope with a lot of things because you cannot heal hearing loss. You only can compensate for it. So what is damaged in your ear, so that the small hair cells are broken, they will never regrow. So that means just making it louder doesn't help because you still don't tolerate when it is louder. So you just want to get the right information louder at these frequencies you can't hear anymore.
Do you recognize, Erin and Humanyung, the story that Thomas is telling us today, Erin?
Yeah, I mean, I think he touched on a really great point that, back when I worked as an audiologist in a clinic, I would hear from a lot of people coming in, is that sense that, I have a hearing loss, I just need something to turn up the volume, give me that volume back, and that will solve my problems. Everybody is used to the concept of glasses, putting on a pair of glasses, and then your vision is, perfect, so to speak. And so there's an education component when you're working with somebody who's getting hearing aids to kind of help them understand that it's not the same as putting on a pair of glasses. It's not just turning up the volume and then you have your hearing back. It's a tool to help you compensate. It does a lot of very intricate and complicated processing of the sound to give you back volume, but also to kind of enhance the clarity that you need to kind of compensate for that hearing loss that you've got.
Back to you, Thomas. So what's your advice, if we could sum it up, to keep up good health and to keep up, trying to focus on solutions?
It's twofold. One is young people should be aware that they got a gift of several thousand small hair cells in their ear where they have to take care. They will never regrow. What is gone is gone. So take care of your hearing. And that goes to the second part. Take care of your hearing also when you are getting older or when you have problems. Start to look at it as early as possible, because when the hearing loss is not so severe, it's much easier to get used to it than if you have, let's say, a history of 7 years not hearing small sounds, and then your brain has to be retrained to listen and perceive these small sounds, which are all not important to you. So it's all take care of your hearing to the life, early and late.
Thank you, Thomas, for bringing in those very good advices. Just make a conclusion here. Your best tip for advice for our wearers out there regarding mental health and being able to cope with these kind of solutions, what would that be?
I think I would echo that. Check your hearing.
Yeah.
This is what Thomas also mentioned. Check your hearing early. And then as soon as you get the result, as soon as you see you have a hearing loss, go see a hearing care professional and then get it fitted, try it out, and I'm pretty sure you're going to be very happy.
Yeah, and your last advice, Erin? How does it sound?
I would echo that and say, do yourself a favor. If you feel like you're struggling a little bit, if it's becoming a little bit difficult, you don't have to live with that stress or that fatigue. You don't have to feel like you need to pull back, and you don't have to feel self-conscious. There are steps you can take. Just, go get your hearing checked and start talking about how to solve it.
Humanyung, Erin and Thomas, thank you, the three of you, for joining Brilliant Talks. We have more guests and more stories to keep the conversation going. So be brilliant and see you next time.